It's been an epidemic since the late 1980s, and it's something our community still struggles with today. Although modern medicine has seen many advancements in HIV care through the last 4 decades, the disease continues to spread, with cases of hepatitis C also on the rise. Today, we are joined by infectious disease specialist Dr. Gul Madison from Mercy Fitzgerald Hospital, whose passion around today's topic is something she prides herself on being able to treat throughout her career. Dr. Madison, thank you so much for joining us today.
Thank you for having me.
Thank you. We're thrilled to have you here. And I would love to first just get to know you a bit better, hear about your background and your passion for this topic.
I'm a board-certified infectious disease specialist. I have been with Mercy since 2014, so it's going to be 11 years this year. I did my fellowship in infectious diseases in Westchester, New York Medical College, Westchester, and did my residency training in Englewood Hospital in North Jersey. I am originally from Turkey. I went to medical school in Turkey. And I found my passion in HIV when I did my fellowship in New York. We were very fortunate to go to 2 hospitals during our fellowship, one of which was the New York Metropolitan Hospital, where we saw a lot of underprivileged, underserved communities where HIV was very common, and I was thrilled to see that I could make a huge difference in the lives of these patients. And it's been, almost actually more than 20 years now, so here we are.
Yeah, thank you for that, and thank you for the work you're doing. So in terms of these 2 diseases that we talked about in the introduction to this episode, HIV and hepatitis C, would you mind just telling me and our viewers a little bit more about what both of those diseases are and maybe some symptoms of each?
These are both viral illnesses. They are both chronic. HIV has been around since 1980s. It's caused by the HIV virus, generally sexually transmitted, also transmission through IV drug use. This virus gets into the body's immune system and typically gets into these cells called CD4 cells, part of the immune system. And over time, it destroys these cells. With that, individuals infected with this virus have a reduced immune system, and they are prone to getting other infections or cancers, which can ultimately kill them. And they can spread the infection through, to their partners as well. Hepatitis C is also a chronic viral infection. It is, in this country, it's most commonly transmitted by IV drug use. It infects the liver cells, and it can be asymptomatic for years, decades sometimes. And in time, it causes liver damage. So this liver damage can be anywhere from relatively mild to advanced, causing liver cirrhosis and even cancer. There is a cure available for hepatitis C infection, and there are very effective treatments available for HIV infection.
It's so promising just in the time that HIV has been around, just the advancements in treatments, and that's encouraging to hear about hepatitis C as well. Can you tell me a little bit more about the symptoms of hepatitis C specifically?
Hepatitis C is a very insidious viral illness, meaning you may not have any symptoms for years, decades even. That is why routine screening of adults is recommended. And I have treated many patients who were diagnosed this way by routine screening, and they had no idea, no symptoms. If it gives symptoms, it could be very nonspecific. That could be fatigue, sometimes abdominal pain, maybe mild nausea. In advanced stage, if patients develop advanced liver disease, cirrhosis, then you would see signs and symptoms of cirrhosis, which could be swelling of the legs, swelling of the abdomen, extreme fatigue, loss of appetite, episodes of bleeding, but these are the most advanced stages. Generally, most people do not experience much of a symptom.
So your recommendation would be to get tested.
Exactly.
So as you mentioned, both are known to be sexually transmitted diseases, but you did mention other risk factors involved for the transmission of HIV and hepatitis C.
Of course, as I said, sexual transmission is the most common with HIV communities, LGBTQ, again, people who use IV drugs. These are the people who are at highest risk.
So 40 years ago in this country, when HIV was first discovered, there was a huge stigma around it. And I know that even to this day, even though there have been such advancements in it, there still lies a stigma. So for you, reaching these patients that might worry that they might have an HIV diagnosis, how do you help them get around that stigma so that they can access the care they need?
Stigma is still there, unfortunately, if not as big of a deal as in 1980s. It is still an important stressor in our patients' lives. Being diagnosed with HIV is a huge blow to the patients, and they worry that their HIV status will be found out by family, friends, and this adds an additional stressor to their already difficult life. When I first see a patient newly diagnosed with HIV infection, I give them hope. And I tell them this is not a death sentence any longer. We have so many treatments available. And as long as you have access to care, as long as you take your medications, you will have a normal, healthy life. You and I will work together on this. We're partners. So I always take extra time in this first visit, talk to them, hear their concerns. Every patient has a different concern about this diagnosis. So starting them on medication is only a little part of it. The majority of the first visit is hearing their thoughts, hearing their concerns, and trying to answer, trying to tell them this is not the end of their lives. We will treat them, and they will be fine.
That's so encouraging to hear. And I know a lot of that is just the medical advancements that have taken place in these last 40 years. Should a patient come to you with an HIV diagnosis, are they able to get the access to these medical, these treatments that can help prolong and give them a good quality of life, which is, I love that you worded it that way.
In this country, we're very lucky. We have so many medications available to treat HIV. And insurances do have coverage with majority of these medications. If needed, we can, apply for prior authorization, and we get these medications for our patients. And even those who don't have insurance, there are many programs that they can apply to and get their medications, labs, and doctor's visits covered.
Wow. I was actually going to ask you about that. So is that something that if you were seeing a new patient, you could help educate them about how to get access to care even without insurance?
Absolutely. We have access to case managers who do know a whole lot more than I do about how to access these programs. They evaluate these patients and find what's best, what best fits them, and refer them to these programs. And ultimately, patients get the care that they need.
That's great. That's such a theme that I've noticed in interviewing some of your colleagues throughout this podcast series is kind of meeting people where they are and helping that access to healthcare. I mean, it just, the quality of life of your patients, I know it improves them greatly. From your opinion, all of your experience in this world, how would you recommend that we remove some of this stigma around HIV and also around hepatitis C?
Talk about it.
Yeah.
I think like what we're doing right now, just people need to hear that you will not get HIV by sitting next to a person with HIV,
Right.
or hugging them or kissing them or just having them in the same room. It's time to educate the public. It's time to talk about these things. If you don't talk, then stigma grows,
Right.
and deepens. I think our patients need that. We do owe that to our patients. It is time.
Yeah, and when the stigma continues, it keeps people from seeking the care they need, which I'm sure, in your line of work, when you're looking at an infectious disease outbreak, it's not helpful for containing that.
I have seen many patients who waited for years before seeking care because of the stigma.
Right.
And this is a disease that may not give you a lot of symptoms for years. And by the time it gives symptoms, it can be pretty advanced.
Right.
And at that point, I've seen patients like that who presented very late. And we sometimes can help them, but sometimes we can't.
Right.
And it is sad to see that at this day and age,
Right,
in
because
this
they
country
didn't
where
come
all
forward,
the
right.
resources are available, we can help them. So it is very sad. And I think part of that is stigma, as you said.
Absolutely. And one of the things we were talking about stigma, but also I would guess testing, right? If
Yes.
we talked a little bit about the risk behaviors before. So if you maybe have a lifestyle where some of those risk behaviors present themselves, would you encourage, to get tested?
Absolutely. In fact, the recommendations is to test everyone from age 13 to 64 at least once.
Wow.
So everyone, even adolescents, should be tested in this age group at least once. And if there is someone who's at high risk group, multiple sexual partners, or IV drug use, or if they feel that they are at high risk, then they should be tested more frequently. So this could be anywhere from every 3 months or so.
Great. Thank you for that recommendation.
Of
I know
course.
that's helpful education. This has been such a great conversation. I've learned so much from you. Is there anything in closing you'd like to add as we round out our show?
Again, I want to give hope to patients and families who are close to people living with HIV. Encourage them to seek care and know that you will be taken very well care of. The medications will keep you healthy, and you will partner with your provider. You're not alone in this, and you can get treatment. You can have a normal and healthy life.
Thank you. That's such a message of hope when it comes to
Absolutely.
in your lifetime and the time you've been practicing to see that advancement.
Absolutely.
HIV and hepatitis C do not discriminate based on your gender, race, or sexuality. Everyone should know their HIV and hepatitis C status and be treated if affected. If you or someone you know has been diagnosed with HIV or hepatitis C, Dr. Madison is accepting new patients. To schedule an appointment with Dr. Madison, you can find her office's contact information at the link in the description below. Thank you for joining us today on Beyond the Stethoscope. Hit that subscribe button to get new episodes every other Thursday.